Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, give us a like, subscribe. Today, my guest is Dr. Mabel Che-Tuma. Dr. Che-Tuma is a registered nurse, a nurse entrepreneur, a financial planner, and a health coach. Welcome, Dr. Che-Tuma.
Thank you, Del.
Let me start by thanking you for agreeing to do this. I really do appreciate your time. So thank you so very much.
You're welcome, Del.
So typically, I really want to know when I start, I want to know, first of all, why people are nurses. So why are you a nurse?
I'm a nurse because I like helping people. I became a nurse several years ago because I really enjoy helping people. I like the satisfaction that is gained from somebody improving by me just being the person at the bedside helping them, or whether that be at home or in the community.
Okay, that's awesome. Is that something you always wanted to do?
Yes.
I find I ask that because when I speak to people, I know there's a lot of nurses didn't start out necessarily wanting to be nurses. They started out wanting to be teachers and all of this other kind of thing. And somehow or other, it comes around to being a nurse.
Well, on that note, I growing up, I wanted to be a journalist. And I grew up in Africa, and that was my dream, to become a journalist. But when I immigrated to the United States, that dream quickly changed to getting in a space where I could be of service to people and help people just get them better.
Yeah.
I had a family member who got sick in Africa and actually passed away, and the care wasn't that good. So I felt like I could position myself strategically to learn what I needed to learn, become a nurse, so that I could also impact not only people in my family, but also take my services to people in the community and in the hospitals as well.
Awesome. So what kind of challenges were there for you with that?
Becoming a nurse? Nursing school was tough. I made it. I'm so happy that I did. Nursing school was challenging, but I'm so happy that I stuck with it. I just studied hard and I made it happen.
Yeah. It can be tough. It can be a lot tougher than people anticipate it's going to be. A lot more challenging. You know, you spend a lot of time thinking, I am so done with this.
Right.
Anyway, so having become a nurse, in what areas have you worked?
I've worked intensive care, I've worked primary care, I've worked cardiac telemetry, I've worked GI surgical, I've worked primary care, I've worked psych. And I'm sure you're going to be wondering, like, why all this experience? Well, I got all this experience because when I finished nursing school, I wanted to become a nurse entrepreneur. And I figured in order for me to become a nurse entrepreneur, I needed to have a lot of experience. So I strategically did that. It was very deliberate. It was intentional. I worked on one unit for 1 or 2 years, and I went to the other one, and I went to the other one. I also have some experience in psych because I used to manage the crisis stabilization unit at a hospital here in Florida. So I decided to have a wide background in my experience and also got into leadership because all of that experience is necessary when you want to become an entrepreneur.
Absolutely. And so you're an entrepreneur, and that leads me into now you're a financial planner. Yes. How did that come about? It seems like, you know, I realize you're still helping people, but a financial planner.
Yes, well, I became a financial professional a couple of years ago for a couple of reasons. As a business owner and as a nurse entrepreneur, one of the things that dawned on me very quickly, my husband and I own the business, is that we were paying a lot in taxes. And we just didn't understand why. We thought that there was something that maybe we could be doing differently with our taxes. Then I decided to learn a little bit more too. We were just losing money all kinds of ways. So I decided to learn a little bit more about really how money works, because the truth about it is that the average nurse works very hard. We work very hard, get up, go to work, but we don't understand how money works. So, and that includes me. I didn't understand how money works. Right. So I decided to really learn it, get licensed in it, so that I could help myself first, my staff, so that we could help ourselves first, learn how to structure things in such a way that we too can benefit from compound interest. We too can structure our accounts in such a way that it can avoid probate. We too can structure our accounts in such a way that we could take advantage of we get sick and then we don't have to worry about where is the money going to come for us to take care of ourselves. So there were just a lot of things there that I found as opportunities where I could help myself first and then really take it out there and focus on helping nurses also structure their own portfolios accordingly in such a way that, you know, you really can go to work knowing that your portfolio is set. You don't have to worry about how it grows because some of the portfolios that we set actually guarantee that you're never going to lose a dime of your money.
Awesome. That is huge. That really is huge because, as you say, you know, so many people, so many of us, I will include myself in that, don't really know how money works. And it's as you say, you work really hard for the money. So yeah, having someone guide you as to how to structure it is an awesome thing. It's an awesome thing. I'm so glad you went into that.
Well, just to add to that, you know, going back again, it's ironic that we get up every day to go to work to make money.
Yeah.
But it's ironic that we don't understand money, we don't understand how it works, and we don't understand how to make it work for us. And the truth about it is that if we cannot make our money to work for us, we're going to work till we die. Yeah. So I am very passionate about what I do in the financial space. Because we really do have to understand some of these things. There are basic concepts that are not taught in school, and nobody's going to come after us to teach us how some of these things work. So as an independent financial consultant, I really take the time to educate nurses. I focus on nurses really because I'm a nurse too, right? I focus on nurses because I'm a nurse, and I just know, I worked at the bedside for many, many years. We work really, really hard. And I am passionate about nurses because I know the amount of work that it takes for you to go work that 12-hour shift and then have your money be sitting in a place where you're pretty much losing it to inflation. It's not doing anything for you when you have your money sitting in certain accounts. So I am very passionate about what I do as a financial consultant.
So on that note, and before I forget, I don't want to, it's not digression, but I'm going to digress a little bit and say to anyone who's listening that they're going to be able to find information about how to contact you in the description box of this video. Before I go any further, I don't want to forget to mention it to people who are listening to us today. All right. And so now you also are a health coach.
Yes. Oh boy, I love what I do on that space too. So I'm a healthcare coach with the Habits of Health program designed by Dr. Wayne Anderson. It's an evidence-based practice program designed by a physician, a cardiac anesthesiologist, who spent a lot of time in the OR doing surgery, cutting people open for things that he felt like could have been addressed from a primary preventive healthcare standpoint. And so he decided to design this program called the Habits of Health. It's very, very effective. It's efficient. You're guaranteed to lose between 3 and 5 pounds every week. If you do the program the way I ask you to do it, no worries. I also run a WhatsApp group where I bring in everybody who decides to join the program under my leadership. I put us all in the group where we do public display of accountability. We put our weight there. If you're just starting out, you put your weight in that group. As you're losing the weight, you put it in there so that we can clap for you, cheer you along, because there is something to be said about public display of accountability.
Yeah, yes, there is. Yes, there is. It's a little harder to do stuff on your own.
Right. And just to add to that again, you know, a lot of times when I want to talk to people about the healthcare coaching part of what I do, people say, I've been exercising and I've been doing this and that. I say, let me be the first to tell someone that, you know, fitness is really 80% what you eat and only 20% exercise. So, and many of us grew up eating foods that are calorie very, very rich, but nutritionally barren. So in Dr. Wayne Anderson's Habits of Health program, we want to flip that around. We want to change that. We want to encourage people to do a diet that is nutritionally rich, but calorie barren. So it gives you everything that your body needs, and it also helps you stir up your metabolism and helps you to lose the weight. so that you're balanced. Because at the end of the day, if you cannot lose the weight and get your weight in a good place as we get older, guess what? Things start breaking down. The inflammation is real. The abdominal weight is real. The weight in itself is real. Then we start looking at disease processes like high blood pressure, diabetes, hypertension. Oh my, the list can keep going on and on. Inflammation is real as we get older. So I am so happy that I'm able to coach in a platform where we address all those things by just changing the habits. How you.
So I have a question about that, because many times people start out wanting to do stuff like this, but I think they're not really willing to do the actual work that it takes. So at what point do you think that they convert from, you know, being kind of casual about it to being really serious and willing to want to do the work?
Well, it starts by setting goals. You have to want to optimize your health. I am almost reluctant to say that. I'm almost to the point where I can say that if a person is not 100% committed, I don't want to help them, because you're going to waste your time and you're going to waste your resources. If you're ready to take action, if you're ready to work on your finances, if you're ready to work on your health in terms of losing weight and stuff, please, you are my person. I want to be able to talk to you. I want to be able to help you. But if you just think this is something casual, especially if you have the weight and it's worrying you, because you know what weight does, right? It can actually leave you in a very bad place. Depression. I mean, I can go on and on and on and on. So if you're ready mentally, physically, psychologically, emotionally, financially to get your health to an optimal place, I want to coach you. But if you're not ready yet, we can talk casually. I can talk to you and just get you to that place where you're ready, and then we can start the program.
So we're talking about people being ready. How do you and them recognize that they're ready? Because sometimes people feel like they're ready, but they're not. So how do they know? What makes them say, you know what, I am committed to this now. I really have to do this.
It boils down to your why. Why do you want to do this? Why do you want to do this? It's the same thing with the financial stuff.
Yeah.
Why do you want to fix your finances? Why do you want to fix your health? And once you've identified your why, if your why is big enough, I dare to say you're ready. Okay. But if you have not set the time to do the analysis and really think about the consequences of piling that weight on your body, you're not ready yet. You gotta have a why. Yeah. Yeah. And there is a health assessment that I do, a quick health assessment that I do. And when I do the health assessment, when it's done, I calculate your BMI. I tell you, I know when people are ready, because when we start talking about your habits, we're going to talk about healthy hydration. We're going to talk about healthy activity. We're going to talk about portion control. We're going to talk about activity. How much activity do you have to do? So by the time I do that assessment, believe me, I know.
Awesome. Because I realize often that, and one of the reasons people fail in their efforts to do these things is because, as you say, they weren't really ready in the beginning. So I know you're still working as a nurse, right? So are there any aspects of nursing life per se that you would like to see change?
Yes. Oh my. Absolutely. A lot. Yes.
Take us through a couple.
I'd love to see the nurse-patient ratio in the hospital and nursing homes change. Yeah, I'm not sure that I have anything within me to change that.
To affect that.
Yes, but I'm not sure. Of course, I mentioned that I'm a nurse entrepreneur. My husband and I own a home care agency here in Gainesville, Florida. And I'm really happy about what we do there, because we don't have to worry about nurses being overwhelmingly stressed, because we do one-on-one care. We have one nurse taking care of one patient, or one home health aide or one CNA taking care of one patient. But I worry about what happens in the hospital settings and in the nursing homes, because the nurse-to-patient ratio is a lot. And then you asked me for two things, right? The next thing is this whole, now we're dealing with things that are at a global level, the pandemic, COVID.
Yeah.
It's putting a toll on healthcare providers. So I worry, because we already have a nursing shortage.
Yeah.
We already have a nursing shortage. And now with more and more people being sick and not taking care of their health, So that's where the weight thing comes in again. If you look at the number of people who died from the pandemic, if you really want to analyze it, I don't have any research to back it, but I'm sure if I even go look at some data, I'll see that many people who died during the pandemic, who were affected by COVID, and all these different variations of it that are coming up, are people who had a whole lot of weight on them.
Yeah, yeah. Yeah.
So yes, and so those are the two big areas. We have things that are happening at a global level, the pandemics affecting pretty much it. I think COVID is gonna when it's all said and done, it'll affect everybody.
Yeah. I absolutely agree with you. I agree with you there. It's not going anywhere. We have to live with it. All right. This business about nurse to patient ratios is really a big thing. It really is a big thing. I see it. I'm pretty much retired, but this is not a new thing. And it contributes to because you start out wanting to be a caring person, wanting to help people and to see them progress and do better. It leads to a lot of guilt on your part that you cannot do more. You cannot do more, you know? And so nurses tend to take on more. We tend to, yeah, I'll come in for the extra shift. Yeah, you can give me this extra patient. Yeah. And, you know, so being a health coach to nurses is a huge thing, even from just that point of view, because apart from the physical thing, we carry a lot of guilt.
We really do.
Yeah.
We really do. I mean, we're caregivers. And then we also have to take care of, you know, the patient in the hospital. We have to take care of our family. We have to take care of ourselves. And you know who gets neglected in this picture a whole lot? It's the nurse.
Yes.
Is the nurse. So we are caregivers. Fundamentally, that's what we do. And so that's why, for me, I decided to step out a little bit and really try to help nurses. I want to help nurses with their finances and with their health.
Yeah.
Because if somebody doesn't do it, we're just going to continue to go down the drain. And we need nurses. We provide a valuable service. Without nurses, guess what? Nothing works in the healthcare system.
I know.
Doctors can function without us.
I know. And the other thing is that really we're everywhere. When we talk about the healthcare system, our vision is institution, but it's bigger than that.
Oh, it's huge.
It's
public,
big, it's much bigger.
Community health, hospital, anesthesia, medicine. I mean, we're everywhere. We provide a valuable service. I smile a lot when I brag about being a nurse all day long, because the scope of what I can do as a nurse is unlimited.
It is unlimited.
I am a nurse first. It falls, I am a nurse first, and I brag about it. I'm so proud that I became a nurse. I am so proud that I can do many things from the platform of being a nurse.
We're just everywhere, and we can do just about anything. And I really want us as nurses to realize that, because I think very often we get bogged down into the daily caring thing and just don't realize just how vast the scope is, how many opportunities there are, and where we can function and function well, you know, and bring our expertise also to so many different groups. I think we're limiting ourselves a little bit. So on that note, speaking of limiting ourselves a little bit, and you're talking about, you know, nursing life, where would you like to see nurses in the future? What is your big vision?
I want to see because when I got my doctorate in nursing, one of the things that I did was I taught in the RN to PSN program at a university here in Florida. And I'd love to see more RNs become bachelor's prepared nurses. And I feel like we're doing that already, but not a lot of nurses are taking the opportunity, because when you look at the RN is a bedside nurse. That's what they're trained to do, and they're very good at what they do. But we have to, when you start looking at evidence-based stuff, and when you start looking at really trying to back what we do with evidence, we have to take those classes to get us further along, to get our bachelor's degree. Because when you get a bachelor's degree, you get taught a research class. You get taught in statistics how to read evidence-based articles and how to apply that to your practice. I'd love to see nurses spend a little bit more time doing that. I feel like we have a lot of nurses who are bedside nurses, and they're doing great work. They're doing great work. But we need to start really, and I think some hospitals are doing that. Many hospitals are to the point now where if you don't have a bachelor's degree, you can't work on certain units. You can't take certain leadership roles. You can't. So I feel like that is a big vision. I want us to be able to back most or all of what we do with evidence, even though that's the big picture.
Okay. All right. Since you have been teaching, what advice would you like to give to anybody who's considering being a nurse? Advice, words of inspiration.
Oh my. I feel like there is a huge need for nurses. Anybody who wants to become a nurse can be a nurse. Don't get discouraged. I feel like go to nursing school, put in the time, study. If you don't pass it the first time around, please repeat it. When one door closes, another one opens. If this school took you out of the program for whatever reason, because it happens, right? Go to another school. Because there is a huge nursing shortage. We need nurses who are compassionate. We need nurses who are going to go out there, perform services, go above and beyond. There's so many nursing schools out there, and nursing schools are turning out nurses every day, but there is still, I don't even know where the nurses go, but I feel like there is another trend that is happening in nursing now. There is something that we call burnout. Nurses get out of school, they go on these units and they work. And then in the next 10 years, 15 years, they have what we call burnout. And so we have a big population of nurses who are getting out of the nursing profession and going into things like IT. That's another thing too, that again, if we correct the stress that comes on nurses, we might be able to return nurses more in the nursing profession. So yes.
And we've seen that burnout a lot especially in the last couple of years. People are just leaving the profession because they just can't do it anymore. And I cannot, there's no blame to be assigned. It's just that the way things are, the way circumstances are, nurses have worked themselves, burned the candles at both ends and in the middle for so long that, they've just like, I can't.
That's right.
So, I really would like to see, nurses being better taken care of, starting with us taking care of ourselves. Speaking of taking care of selves, what does self-care mean to you?
Wow. Self-care means we have to stop. We have to take a deep breath. We have to analyze ourselves. Where are we? What is your stress level on a scale of 1 to 10? Every single nurse has to ask themselves that question. What about my health? Do I need to optimize it? What is my BMI? What is my weight like? Right? How much water am I drinking a day? We gotta be drinking at least 64 ounces of water a day. We gotta be exercising at least 3 days a week. We have to include some meditation in that. We have to watch what we eat. We have to watch the portions. A lot of us work at night. And when we work at night, you know what we do? We eat at night. That's not how we're supposed to eat. We gotta watch everything that we do, because at the end of the day, we are caregivers. We gotta be around long enough to enjoy our careers, enjoy our profession, enjoy our children, enjoy our families, and also set aside time just to distress, set aside time to meditate and set some goals and do some things that are fun. It's not all about work. We have to take some time out to do some things that are fun, some things that are enjoyable, without which it becomes very, very bothersome. And that is where the stress kicks in.
So you mentioned stress a couple of times. And I often wonder if we actually, as nurses, recognize stress in ourselves, in ourselves. I feel like we have become so used to working and being in stressful situations that it's one of those things that, builds and builds, and you don't even realize that we're stressed. So do you think we recognize it and early enough?
Do I think I recognize it?
Do you think we, as nurses, each of us in ourselves, recognize when we are stressed?
I think many nurses don't, but I think it really boils down to taking the time and analyzing you. Where do you wear your stress? I wear my stress at my shoulders. When my shoulders get tense, I know that I'm very, very stressed. Different people wear stress in different places, and it manifests itself differently in other people. Some people just get sick.
Yeah.
And you have to think about what stress does to the body. Stress triggers a lot of things. As a matter of fact, sometimes stress can get you in a sympathetic nervous system where you're constantly running. And once we're supposed to be in the unsympathetic nervous system, that's the baseline. But when you become so stressed and you shoot yourself into the sympathetic nervous system, where everything in your body, the immune system is going wild, inflammation is taking place, all these things are taking place at the cellular level. Sometimes the biggest manifestation of that is illness. You end up in the hospital.
Yeah.
And you cannot even figure out, first of all, why did you end up in the hospital? Think about what happens to your blood sugar. Think about the fact that the pancreas cannot secrete enough insulin to break down all the sugars in your body. A lot of it is related to stress. You see, so we have to, first of all, start really analyzing and thinking about what is the trigger for stress for you? Are you actually stressed? What does that look like for you? It looks different for everybody.
Yeah.
And until you start taking the time to analyze that and figure out, for a lot of people too, it's finances.
Yeah.
Finances will shoot people in a stressful situation and have to think about going to bed, not knowing how you're going to retire, which is why I come in, by the way. That's one of the things I focus on when I'm talking to nurses.
Yeah.
Not knowing how you can't go to sleep because you don't know how you're going to retire. Yet you've been working for 15 years, 20 years. You've sent all your children to school and you're sitting over here thinking about how you're going to retire.
Yeah.
That's a big stress for a lot of nurses.
That's huge. That's huge.
So you got to figure out what is your trigger. What triggers you in a state of stress? Once you figure that out, you can start to fix the problem. Especially if you're constantly in the hospital, you're taking medications. And I believe things like high blood pressure, diabetes, high cholesterol, those are all things that have two ways of managing it. You can manage it with medication and you can manage it with behavior modification. Let's start with managing the behavior and then we're going to come up the meds.
And then, absolutely. Yeah. Absolutely. So I have a question. I have been trying to collect these words and I want to know, if you had to describe the most essential quality of a nurse in just one word, what would that word be?
Nurses are elegant.
You said elegant. All right. I'm writing that down. And so that's not one I expected. I keep getting words like compassion and empathy and resilience and all of that kind of thing. And you come up with elegant. Why elegant?
I think nurses are elegant because think about what it takes for a person to be elegant. I mean, I think that, my perception of elegance, when I look at I look at their heart. I look at how they carry themselves. I mean, even if you look at research articles, we are considered one of the professions that are most to be trusted.
Yes.
If so when I look at it like that, just being a bedside nurse, you have to be elegant because it comes from your heart. You see that? You show compassion, you show empathy, and all of that, I think, encompasses elegance. Okay. All those little qualities that we manifest make us to become elegant human beings. Because if you're not elegant, you can't take care of a human being.
Okay. All right. That bears some thought. I hadn't thought about it like that. It's not a word I would have come up with, but now that you describe it to me, I can see it.
Elegance encompasses hard work, trust, believe in yourself first, And then you can take care of somebody else. When I call somebody elegant, I mean all those things.
You mean all of them.
And I think that many nurses manifest these qualities on a daily basis in their places of work. If you really think about other professions, people don't have a way to become elegant in their careers. It's difficult.
Yeah. Yeah.
Think about somebody who builds houses.
Yeah.
He goes out there and he has to deal with some material and put it on the roof. How do you manifest elegance that way? It's difficult. So, but we are uniquely positioned in our career, in our professional path to manifest elegance every day. And I think many of us do so.
That's awesome. And on that note, I would like to thank you so very much for speaking to us today. That's really a beautiful thing to say about nurses. Thank you so very much.
You're welcome.
All right. Have a wonderful, wonderful day.